You may have a diagnosis of lateral or medial epicondylitis, otherwise known as tennis elbow or golfer's elbow. Ironically, golf can lead to tennis elbow, and playing tennis can also cause golfer's elbow. So the bottom line is that patients who present with pain on the outer side of the elbow, otherwise known as tennis elbow, or on the inner side of the elbow, otherwise known as golfer's elbow, present in a very similar fashion. It's typically associated with difficulties playing your sport, such as tennis and golf, gripping objects with strength, and even fine motor activities. Most treatment related to this condition is non-surgical. It is very rare that patients will ever require surgery. Typically, it requires an education as to what the condition is. Lateral or medial epicondylitis is really not inflammation, but rather associated with changes in the tendon itself. In fact, inflammation is really not involved at all, but rather there are microvascular changes in the tendon on the outer or lateral or medial side of the elbow. The condition is very similar on the outside and the inside of the elbow, and thus the treatments are also very similar. The treatment is designed to improve the blood supply and reduce the symptoms that are due to those changes in the tendon itself. We often will recommend activity modification, sometimes something called a counterforce brace, which is a brace that we place around the elbow in an effort to distribute the forces more equally, to take the stress off the outer, the lateral epicondyle, or the medial epicondyle. Sometimes we will recommend injections such as steroids or platelet-rich plasma. That, combined with proper occupational or physical therapy, renders most patients asymptomatic. There may also be some modification in terms of what you do in your sports, such as the grip size in your tennis racket, how you swing your golf club, things like that we would discuss in the office setting to help reduce the symptoms and get to the point where you have eliminated them completely. In a setting where non-surgical treatment is unsuccessful in treating lateral or medial epicondylitis, surgery might be warranted. In general, however, we do everything possible to minimize surgical intervention with this condition.